research going on about medicinal plants and what's working. And I feel like right now we're in this potential shift of having more collective intelligence that doesn't necessarily need to be supported by fully corporate or profit. You know, it doesn't need to be profit backed. Like we're in this kind of incredible time where I think a lot of intellectual property, a lot of open source solutions are being contributed. You know, we're, I think, at the tail end of something called the global hack. You know, City of Hope did something called the Can Soon project, where old patents for HIV medicines and antiretrovirals are being researched, you know, without regard to the profitability. So I'm wondering what you're seeing from a technology point of view, that, you know, of how we can better share what's working through blockchain, or, you know, just what's emerging. What can we piece together in our larger global community?
I spent 30 years in information technology. And one of the things that became obvious to me is that the real technology is in the people. Like when you've got a group of people who synergize together, then anything is possible. So I love technology, and I love the warmth and the connection that it creates. You know, the contribution, people are offering their services for free. You know, like a month ago, 6 weeks ago, people wouldn't offer services for free. They had to get paid for it. Yes. So, you know, I see people really putting their energy in, and I think that's a beautiful, I don't know what that means about the future, but that people contributing. And, you know, I mentioned earlier that I think actually the most advanced technology we have at the moment is the technology of consciousness. Yeah, which is, you know, that's where I've moved to. I moved from information technology to imagination technology. And, you know, we're talking here as a panel, but we also have a group of attendees. And everybody's got access to this. And that's where I think the real value comes, is everybody being able to step into themselves and go, what is it I can contribute? You know, somebody may not be a computer programmer, somebody may not know about plant medicine, but we can all contribute something. And so, you know, I get that what I see, that this moment is a moment for us to realize that we do have access to something, and that we can actually make our contribution. You know, Roman talked about passion and purpose, yeah? And, you know, if we're all working from there, I don't know if it answers your question. I think all the technology aspect is, I kind of go, it's all there now, you know, like blockchain and, you know, internet, you know, all the telco, we've got everything we need, yeah, to be as connected. So we're in a beautiful space to actually collaborate together globally. But I do get, it's about us understanding that the vision of what we're going for, and then understanding that it's our individual contribution that makes a difference to that. Yeah. It's not what somebody else is doing. Yeah. It's not what we think the world needs. It's what's inside in us that wants to come out. We can spend a lot of time chasing around thinking, oh, I should be this, I should be that. Whereas actually the truth is inside us, and it may be very, very, very simple. It may be to look after your family. You know, it just may be to pour your love into your family and your community, or it may be to sit down and write a program. Yeah, information technology is a tool. The real technology comes from within us.
Introduction of these electronic gadgets like computer, mobile, you know, the health sector, it has changed like forever, and it's not going to be back again, right? Using computers and software, what health sector have utilized it in different sectors, like in a lab, financing, pharmacy, human resource, data security, even in the nursing stations, and even in the operation theaters or OTs, right? And what is like previously, it was so difficult for people to just go in the hospital, sit in the line, and wait for their queue and everything. But now, what information technology IT has done is they can do everything in online. You know, it was the health sector was pretty good in the first world countries like US or Australia or even the UK, but in Nepal, like for our developing countries, it was quite hard for us. And this information technology is helping us people, right? It's helping very goodly. And this improvement in information technology has, you know, allowed a great reform in healthcare. You know, the people, what they can do is they can send the medical reports to the doctors or healthcare facilities. Now, if you take example of this COVID-19, you know, in this pandemic, Nepal, we are in the second stage of pandemic, right? And nobody they are allowed to just come out, or let's say the government has made some facilities to just go to the healthcare facilities and visit doctors, nurses, or any clinics, right? But the people for NCDs who are suffering from NCDs like diabetes or even some heart patients are, they are not allowed to go, right? Because it's not an emergency case for them to go regular visit, but they have to go. But what they can do right now is they can connect to the doctors or hospitals. So different platforms, or say from information technology, and the doctors and healthcare facilities, they will provide the informations, and even the pharmacists or doctors, they will suggest some medicines, right? So it has like even in the social media, it's made easier by sharing the photos and information, right? And the doctors or healthcare professionals, they just give reply. It helps people, and it has really improved healthcare quality, or let's say effectiveness, in this way.